We are going to have a panel now, which is really not a panel. There will be 4 individual speakers. So this is entitled State of Science and the Law. Our first speaker is Elizabeth Buzzy Guillette, who is also an excellent researcher, as is her husband. She has been interested in the field of contamination, especially regarding human reproduction and children's growth, developmental abilities, and the processes involved with puberty. She comes at it as an anthropologist, so it's a slightly different orientation. Examples of her research include extensive studies, including pesticide exposure in Mexico, which is where I first encountered her, heavy metal exposure in Asia, and the effects of the Bhopal accident on the second generation of parents exposed to methyl isocyanate. She's had enormous influence in the U.S. and around the world, and I just welcome Elizabeth Buzzy Guillette.
Well, hi. Obviously, you just heard my husband speak. Now it's my turn. I kept asking him when he started this work and finding all these abnormalities, what about humans? And his response was, we don't know about humans. No one's ever looked at humans. They're too hard to study. I took that as a real challenge and decided to kind of switch the focus of my anthropological research into looking at children exposed to contamination. And I chose the Yaqui Valley in Mexico for a very good reason. In the valley itself, when the Green Revolution came in, people started using pesticides, irrigation, tractors, and so forth. Well, half the tribe didn't like this. They didn't want to go along with this modernization, so they moved up to the foothills, giving me a good reference site, the same genetics, same style of living, same customs, same food, just not using pesticides compared to those in the valley. And I asked the children, in kind of a play session, to go through a series of activities that would give me an idea how pesticides might be influencing growth and development. And this was kind of seen as games. And played ball for eye-hand coordination. Balance was walking the plank. We played tag to measure how long they could run, how long it took them to recuperate. In all these cases, the pesticide-exposed children did significantly worse. When I talk about significantly, I say 95% or more of them did not do as well as the children in the foothills. Then I started looking at mental abilities. And I started this research when the kids were 4 and 5, before they started school. And did it again, 7 and 8, when they had some schooling. And these deficits continued. Here they were asked to copy, using blocks, a design they were shown. The pesticide-exposed children could not copy the design, which you see on your right. They were doing odd things, like what you see on the left. But surprisingly, when I said, "Is your design correct?" They said, "Oh, yes, I did it." They didn't recognize their mistakes. A picture says 1,000 words. You can see the difference in how 4-year-olds, when asked to draw a person, drew their person. The 4-year-olds in the valley had a horrible time. Some would just draw circles. They'd look at me, they'd look at their mother, they'd look back. They could not comprehend how to put a person on paper. At 5-year-olds, they didn't do much better. Most of the drawings were upside down for some reason. I couldn't understand that. At 7, with 2 years of schooling now, you can see they're still lagging behind the foothills children when asked to draw a person under a tree and put in their pet dog. These exercises took about 30 minutes. And at the beginning, I would say at the end, you're going to get a red balloon. And we'd show them the balloon, and point out the color red, we found it someplace, so they knew exactly what we meant. Sometimes the balloon was blue or green. And at the end, 30 minutes later, we asked them what their gift was going to be. The foothills children, well over half of them remembered the color and the balloon, and all the rest remembered at least the balloon. And in the valley, only about a little more than a quarter remembered balloon and color. Most of them remembered balloon only, but you had a fair number. Couldn't even remember they were getting a gift. And this was meaningful because when you live in extreme poverty, like these kids, a balloon, a toy, meant something. When the girls became 10 to 12, I did a breast study looking at development. And this is about the time when all the papers came out saying girls had breast development earlier and earlier. Something's going on. So I went down to do the same thing. And traditionally, breast development is measured just by looking. Using the Tanner scale, 1 is nothing, 2 is slight development, 3 is more, going up to 5 when you have the mature breast. I decided maybe something's wrong with this scale. And I measured the diameters of the fat tissue. You can see on the pictures where the fat tissue starts and ends. It's going across. And then felt the breast or palpated to feel the mammary tissue, which is hard. Fat is soft, mammary tissue is hard in these girls. And measured the diameter of the mammary tissue. And what I found was that, look at the red, those are the foothill girls, a nice correlation between the amount of mammary tissue and the amount of fat tissue. With those girls exposed to pesticides, and this includes parental exposure, they were all over the place. No correlation at all. But surprisingly, we had girls with fairly large breast diameters. This is up to 12 inches, or centimeters, 12 centimeters, but no mammary tissue development at all. Now, what is the meaning of this on society? You know, if breastfeeding is the only way to keep your child alive in poverty, it could have a huge impact. Now, I want to talk about the whole meaning of this. Lou brought out the meaning of sentinel species to human health. I want to bring out what human health is doing to a whole culture or a whole society, a group of people. You know that typically IQ tests, measure, everybody falls about 100. You have so many really smart, so many mentally retarded. Now, from my observations with this group in Mexico, which I don't think is unique, as I talk to American school teachers and they say the exact same thing, that kids can't draw, they can't remember, and all this. IQ seems to be shifting down. Now, I'm not talking about as an individual. You all have nothing to worry about. Your kids are going to be smart. I know that. But as a society, it just shifts down just a little bit, 5 points. We have a 57% increase in the mentally retarded. That means more and more kids and adults will have to be taken care of in some manner. And we have this loss, great loss, in the mentally gifted, those who are going to be our future leaders, whether they be scientists, government officials, or whatever. Now, how do we interfere, step in and make change? We have the precautionary principle. When health of humans or the environment is at stake, it's not necessary to wait for scientific certainty to take action. So we've brought out already the interplay between environment and humans. A lot of this we cannot prove absolutely to the level that people like. So as humans, we are responsible to protect and restore our ecosystems on which our life depends. And the burden of proof lies with the proponent of the activity. That means the manufacturer of pesticides, not the victims. Over 600 cities in Canada have banned the unnecessary use of pesticides, or in some cases it's called the cosmetic use of pesticides. This means no pesticides can be used on public or private green spaces. It was your lawn, any public park, golf courses. Some cities have included hospitals. Any place that's green, public buildings, you cannot go in and spray. They do use integrated pest management when necessary. Now, okay, so you pass this ban against using pesticides. What does it mean? Somebody's going to complain, yes. Particularly American pesticide companies, you know who they are, file suit. These suits were upheld by the Canadian Supreme Court using the precautionary principle. We don't need certainty to prove that your chemicals are causing harm. You must prove as a company that they are not causing harm. So you have to decide whether you want to be an advisor, an advocate, or an activist. I served as an advisor in many of these Canadian cities, even though I'd love to have been an activist. But as a researcher, you know, I kept my boundaries where they belong. You have to realize that the public has a right to know what's going on, what's causing what, whether you're fighting against pesticides or trying to cause change in some other area. You have to explore alternatives. In this case, it was IBM. And you must bring democracy and transparency to all your actions to get public cooperation. Montreal's had a horrible time passing a ban. It's been fighting now for about 10 years because they don't have all this cooperation. You have agencies working all over the place, but no one is coordinating it, and the public really doesn't understand then what is happening. So I want to thank you for listening to me, but I want you to remember, it comes from Dr. Seuss, under your hat is your brain, and in your shoes are your feet, and it is up to you to select what path you want to take. So thank you very much, and thank you for listening. Oh, I do want to acknowledge I had lots of help, particularly from its son for this research, and the students down there were great in working with the kids. I had lots of help from the Bhopal clinics when I was working in India, and most of my research is funded by NGOs.
Our next speaker is Joan Phlox, J.D. Esquire, who is the director of the Social Policy Division for the Center, can't get this in one word, for Governmental Responsibility at the University of Florida Levin College of Law, where she teaches courses in environmental justice and poverty law. This is the really long sentence. She has worked as a project manager, consultant, and investigator on several environmental justice and community-based participatory research projects focusing on topics including farm worker, occupational environmental health, farm worker housing, community health assessment, recipient health perspectives, worker eye safety, worker reproductive health, and community vulnerability and resiliency. She's done it all. I enjoyed speaking with her when we were planning this session, and so welcome, Joan Fox.
So I want to talk to you about some research that I've done. About 4 or 5 years ago, I wrote a law review article in which I really sought to tie together everything I had learned about social and economic disparities that farm workers face and how that affects their ability to protect themselves at the workplace. And I wanted to look at the situation from an environmental justice perspective, considering that farm workers suffer disproportionate exposures to the environmental hazard of pesticides. So the premise of this and of this article and of this presentation, I only have 3 slides, so, is basically farm workers face social and economic challenges that make them vulnerable to adverse pesticide exposure. And that's basically the description of a lot of environmental justice communities, that the combination of economic and social disparities make them vulnerable to environmental hazards. But there is something different about the farm worker case, and that's that second component, that their vulnerability is increased, not decreased, but increased by the regulatory scheme. In this case, an ineffective protective regulatory scheme. Very simple. So this is a simple, basic graph. Again, you can see the economic and social vulnerabilities up here. And then I'll spend a little time talking about the regulatory discrepancies. Like other communities that face environmental injustices, the farm worker community is marginalized. It's a mainly Hispanic community of low income. And they're subject to health disparities and often substandard living conditions. Unlike other communities, however, they do face the often additional burden of undocumented status there in the social factors. At the workplace, up there in the economic cloud, farm workers are employed in one of the most dangerous occupations in the nation. And adverse pesticide exposure is only one of the occupational hazards that they face. They often lack resources like transportation at the work site if they experience an adverse health effect to get to a health clinic from the workplace. Access to things that could make them safer, including personal protective equipment and even information. And then finally, a combination of factors, including their undocumented status, often puts them in a state of trepidation about job security. Again, what's different about the farm worker community as an environmental justice case is that imposed on top of these social and economic factors are specious regulations and policy. Well, what do I mean by this? They look protective, but they're not for farm workers. In fact, I would argue, and I'll bring this up again after I describe the regulations in a little bit more detail, that the regulations actually do more to harm the community than protect them. So if you look down here, the regulatory discrepancies, I'll talk just a little bit about these. First and most basically, regulations that are designed to protect all of us from adverse health effects of pesticides do not take into account the special circumstances of farm workers. That's the topic of an entire lecture, so I won't go into more detail about that. But there's a couple there's 2 direct ways that regulations were designed to protect farm workers from pesticides, or if they functioned well. The first, the registration, re-registration, and registration review process for pesticides, unfortunately, is very laborious. It's remote, and it's very complex. It's difficult for an average citizen to follow. Only what we call repeat players, like pesticide manufacturers, agribusiness, and special interest groups, and in that I'm including groups like Beyond Pesticides, really know what's going on when any particular pesticide comes up for review. The EPA does not do a systematic literature review and a registration review, and so they may not know what scientific research is going on. with regards to a specific pesticide. As we heard, somebody brought up yesterday, the EPA also considers economic factors, such as the benefits of using the pesticide and the expense of generating data. This is a cost-benefit analysis. Somebody brought this up when they were talking about neonicotinoids and the environment yesterday, but I would urge you to also consider using a cost-benefit analysis when it comes to human health, the human health of farm workers. The problem with this is that the adverse health effects of pesticides for farm workers is a public health issue, not an economic one. The second regulation, directly designed to protect farm workers from pesticide exposure, is the Worker Protection Standard. And this is fortunately, even the EPA has recognized that there are problems with the Worker Protection Standard. It isn't a very old, relatively very old standard, and there has been efforts to try to revise it. Some people in this room have been involved in those efforts. But some of the problems that were recognized were that mandated employee trainings were deficient. There were many things that prevented farm workers from being able to comply with some of the recommendations for self-protection. For example, in Florida, we've seen there are many places where there are no hand washing facilities in the field, so workers couldn't wash their hands at work before they ate, or even before they left work and went to the daycare to pick up their children, for example. Another problem has been that the enforcement of the regulation is devolved to the states, and this has resulted in a patchwork of inconsistent and sometimes ineffective enforcement across the nation. So in many occupational settings, if workers faced hazardous conditions, they would engage in dialogue and bargaining with their employer to remedy the situation. This is where this indirect type of regulation comes in, and that is protecting a worker's right to organize, to engage in collective bargaining, to discuss these things with their employers. Workers' rights to do this and to receive certain standards, such as the minimum wage and overtime pay, have been protected by the National Labor Relations Act and the Fair Labor Standards Act. But from the beginning, Congress declined to extend these protections to farm workers under the doctrine of agricultural exceptionalism. Now, this is something that some of you are aware of, but some of you may not be aware of this. The practice of agricultural exceptionalism is a product of pure institutional racism. It was the result of negotiations between Southern politicians seeking to maintain control over their primarily then African-American agricultural workforce, and Franklin Delano Roosevelt, who wanted the regulations passed as part of the New Deal. The problem is that remnants of that institutional discrimination are still in place, and they affect a different minority workforce, that of Hispanic farm workers. The NRLA still explicitly excludes farm workers, and the FLSA still excludes some types of farm workers. It's difficult for farm workers to organize in the best of circumstances, but without protection from employer retaliation, it's even more difficult. Even when regulations do exist, some employers turn to labor practices that allow them to circumvent their obligations. For example, the use of crew leaders to recruit, hire, manage, pay, and fire farm workers allows employers to be insulated from workers and shift the responsibility of things like worker safety to the employees. So, one way I think that these kind of regulations do more harm than good is just the fact that they exist and they lead people to believe that we have protections for workers through pesticide registration and registration review, through the Worker Protection Standard, that workers have a right to organize because that's guaranteed by the National Labor Relations Act, but the public doesn't know necessarily of the glitches that make these ineffective for farm workers. So, you believe that regulations exist, that they protect workers. You don't know the details about it, so it does more harm than good because workers are not being protected. And then finally, what's the consequence of the combination of the social and economic factors and combined with the regulatory political factors? One of the consequences is that the social economic factors make it difficult for farm workers to challenge the regulatory failures. Workers that lack control over their living and working conditions, workers that are undocumented and unorganized, and who may only know their crew leader and not who the owner of their fields is, where they are working, are not in the best position to challenge adverse conditions, especially if they are deemed lawful under a faulty regulatory scheme. Now, I'm not by any means saying that farm workers on a whole are disempowered, because as we can attest to, farm workers have a very strong organizing culture. And they've been organizing for better working conditions for more than 50 years in this country. But for 50 years, farm worker organizations have been struggling with the same working conditions. And I think that this is a testament to the difficulty of unraveling this regulatory and policy scheme that at this point in 2015 constitutes a little more than a web of discrimination. Thank you.
Our next speaker is Geoffrey Calvert, MD, MPH, FACP. That's the Fellow American College of Physicians. He, for the past, without telling you everything about him, he's very distinguished. For the past 28 years, Dr. Calvert has worked for the Centers for Disease Control and Prevention, where he's been assigned to NIOSH, the National Institute of Occupational Safety and Health. He is an associate professor at the University of Cincinnati School of Medicine. This is, how do you say it, a very high bar in that he has authored over 130 peer-reviewed scientific articles and 18 CDC technical reports. This is a lot of work. He is associate editor of 4 journals, including Occupational and Environmental Medicine. His current activities and interests include acute occupational pesticide poisoning, occupational cancer surveillance, occupational hearing loss, lead poisoning, and occupational disease surveillance. So he's very active. He works for a distinguished organization, and we're delighted that he's willing to speak to us today. Dr. Calvert.
It's a pleasure to be here, to be among this group of passionate people who are interested in protecting health and protecting and promoting health, and also to be among this group of distinguished speakers. So I think I'm part of the Censor Pesticides program, and I think we fly under the radar, but I'm curious if you could raise your hand if you've heard about this program. So there's maybe, I don't know, maybe 10% of people, which, so I'll define what this program is. So we're a state-based program. We work with state health departments, so the state health departments actually collect the data for us. And our colleagues from the Florida Department of Health are here in the audience. And so they're our collaborators here in this state. We began in 1987. We're a sentinel case identification program, meaning so all pesticide poisoning should be prevented. So whenever we identify a case, we try to learn as much as we can from that case so that we can use what we've learned to prevent additional cases in the future. And we have a standardized case definition, so everybody who collaborates, all the state health departments, use the same case definition. We have standardized variables, about 150 variables, so we try to collect as much detailed information about each case that we identify. And we use several sources of data to identify these cases. So the 3 principal sources are poison control centers, workers' compensation data, and reports from the state agriculture department. And so we don't get a whole lot of reports directly from physicians. We maybe get a few direct reports from patients, but primarily it's poison control centers, workers' comp, and the ag departments, the agencies that regulate pesticides, because oftentimes the reports go to them, and then they feed their reports to the health department. So the program is funded by NIOSH and EPA. So NIOSH is the National Institute for Occupational Safety and Health, and we're part of the Centers for Disease Control and Prevention. And I'm in my public health service uniform. I don't know if you've seen many people with this uniform. The Surgeon General is our commanding officer, so you probably have heard of the Surgeon General. You see the warning on the cigarette packs. So it's, it's a great job, but like on Wednesdays when they bring all the cartons of cigarettes in, and that's when we have to stamp the labels on all those. So this is these are the 12 states that participate in our program. And the states with the yellow star receive federal funding, and the states that don't have a yellow star, they're basically funded with just state resources. So you see we cover the entire West Coast, many of the southern states, some Midwestern states, some states on the eastern seaboard. And so the reason that we do this is for several reasons, but one is to make sure to identify areas where preventive action is needed, to ensure that what we're doing currently is effective. So as you've heard in this conference, EPA determines whether or not a pesticide poses any unreasonable risks. So if it poses an unreasonable risk to health or the environment, that pesticide's not supposed to be approved for use. So we come up with this data showing human health effects or acute poisoning, provide that data to EPA, and then let EPA decide whether or not what we're finding is reasonable or not. So our data, we provide trend data. We also provide detailed case narratives so we can tell a story with our data. So we have statistics, but statistics are, as Irving Selikoff said, they're human beings with the tears wiped away. So we like to tell the story to kind of use those stories to resonate with the public, to resonate with policymakers, because it's the stories that really tug at your heartstrings and get people motivated. So this is our data for the rate of acute pesticide poisoning. So the rate is on the y-axis, the years are on the x-axis. It goes from 1998 to 2010. And you can see that the black line is the line for agricultural workers, so essentially farm workers. And then the blue line way at the bottom are all the other workers. So you can see that the rate in agricultural workers is a good 30 times higher than the rate in all other workers. So this tells you that we still have a problem with pesticides, and farm workers and agricultural workers are still at risk. So something needs to be done. And so that's one of the reasons why EPA just last year announced revisions to the worker protection standard. So these are the first major revisions in 20 years. They were proposed last year. And among their revisions are to increase the training to farm workers. Currently it's every 5 years. So the revision will require training every year, annually. They're also going to require that people who use respirators, they have to be taught how to use the respirator, and they also have to be shown that they're healthy enough to wear a respirator, so they have to get a medical examination to ensure that they are healthy enough to use the respirator. There's going to be age restrictions, so you have to be at least 16 to spray any pesticides. They're going to establish more buffer zones. There's also going to be enhanced record keeping and notification requirements. For example, if a farm worker has to go into a restricted entry area, the farm worker has to be told why they're going into that area, the potential health effects of going into that area, what the farm worker can do to protect their health, and then the owner has to document that they've provided all this information, and then the farm worker has to sign documentation to prove that he's been told all this, given all this information. So a lot of these revisions are based on published reports that we worked on or produced, and among those reports that are extensively cited in the documentation for the revised standard are these reports here, including the first one where we talked about the poisoning among working youth. both in agriculture and non-agriculture. We talked about a cluster of birth defects involving 3 farm workers who worked on the same farm here in Florida. One of the children was born without any arms and legs. Another one was born with severe birth defects that resulted in death within a few days of birth. And another one with a small jaw and a high arched palate. So all these mothers were basically working at the same time for the same grower. Actually, the grower was making the small tomatoes that you see the picture here on your, but I'm assuming these are organic tomatoes. Versus these women were not working. They were going into fields with under the restricted entry interval and not being told that there was a restricted entry interval in place at that time. So we also wrote reports about the magnitude of pesticide poisoning and identified the root causes for why they were getting poisoned. And also we had an article about the problems with off-target drift. But we just published this report back in January, and you've got a copy of it in your folder. And it documents some problems that aren't currently being addressed in the Worker Protection Standard revision. So this article raises attention to off-target drift. It raises attention to some recently marketed pesticides and also a gap in worker notification requirements, which is the gap in the current revision to the Worker Protection Standard. So this event occurred last April, so about a year ago, in Washington State, and there was a whole cluster of off-target drift events going on in Washington. Most of them involved sulfur, applications of sulfur, but this one was a little bit different, and it involved the pesticides novalurin, pyridibin, and triflumazole. And the reason that they were applying these pesticides to a pear orchard was to prevent psylla infestation, which is a major pear insect pest. It evolves pretty rapidly, so they have to keep coming up with new chemicals, new insecticides to control psylla. It reduces a plant's photosynthetic capacity. It gets on the plant, injects some toxin into the leaves, which causes the tree to produce deformed fruit with reduced value. So next to this pear orchard was a cherry orchard. And so the application started at around 8 in the morning, and it's a big pear orchard. So at around noon or 1 p.m., in the neighboring cherry orchard, a group of 20 farm workers entered the cherry orchard and pretty much, got to about the border with the pear orchard. And that's when the applicators who were driving these air blast sprayers, and basically they're an air blast sprayer, you have a tractor, and then behind there is this machine that's blasting pesticide up into the pear trees. So it's producing pretty big clouds of pesticide. So there were 20 Hispanic farm workers there. They were tying these cherry branches to improve fruit yields. Average age of these, they were almost all women. One man, 33 years was the average age. And all of them were exposed to drift and all became ill. And they were dispersed across this orchard from between 30 and 300 feet from the pear orchard. And the applicators, they were in full PPE, had the respirators on, the hoods, the whole suits, so they didn't get ill. So there's controversy as to whether or not when the farm workers, or when the applicators saw the farm workers. So the applicators deny that they saw these farm workers, and the farm workers, they claim that they even went up to the applicators and said, look, we're getting sprayed, you need to turn these machines off. And the applicators we have a job to do, we got to get this field sprayed. So within minutes, the farm workers started to get sick. They called 911. The EMTs arrived, decontaminated 5 workers, transported them to the emergency department. Eventually, a total of 16 workers sought health care. And as I said, all of them got sick. And About 8 workers were contacted at least 2 weeks afterwards, and out of the 8, 6 were still having symptoms, so 75% were still symptomatic. And they had 6 of the workers, so 6 out of the 20, had moderate severity illness, meaning it's an illness that requires medical attention. The other 14 had low severity illness, which doesn't necessarily mean you need medical attention, but still, it's not fun to be sick, not knowing if you're going to survive. So even a low severity illness is something to be concerned about. So, and this is a list of the symptoms that these farm workers were experiencing. Neurologic symptoms, including headache, and paresthesias are like an abnormal sensation in your skin. 95% had gastrointestinal problems, including nausea, some vomiting. 85% had eye problems, including eye pain, eye irritation, and 80% had lung problems, including upper respiratory inflammation and shortness of breath, dyspnea. So the Department of Agriculture, the Washington State Department of Agriculture, investigated, collected samples, including clothing samples. It was hard to get the clothing samples. How am I doing on time? Oh, I'm about out? So, okay, let me just wrap it up here quick. And we'll be having a panel this afternoon, so, or I guess after this one, so people can ask more questions. We have limitations with this. Again, it's a mixture, so we heard about mixtures. We weren't sure what specific chemical was responsible for the illness. We didn't have diagnostic tests, so we couldn't pinpoint definitely that these people were poisoned by these pesticides. And the whole gap in notification was, the issue here is that according to the worker protection standard, if you're going to do a pesticide application, you have to notify workers on your farm. But there's no requirement to notify workers on the neighboring farm. So that's kind of one of the key issues, and so that's not being addressed in the revision either. So there's no requirement to notify people on the neighboring farm. And in the past, this wasn't an issue between these two farms. The management on both farms would communicate with each other, notify each other of upcoming applications. But in this situation, the management there'd been like kind of a replacement of the managers of both farms. So the new managers weren't aware of what had been done in the past, and so there was in this situation, the managers of the pear orchard did not notify the cherry orchard. And then, so these are some other things that we're working on. Illnesses associated with paraquat, diquat, looking at pesticide exposure at schools currently, looking at acrolein. Also an issue here in Florida is paladin, dimethyl disulfide. And we're also, something I don't have on this chart, is looking at exposures in food processing facilities. So in conclusion, we're a small program. We're not the only surveillance program in the pesticide poisoning surveillance program in the country, but we think we've been productive. We work with state health departments, building on CDC's long history of working with state health departments, and we think we're the best, but by no means perfect. So couldn't do this work without my state health department colleagues, and thank you for your attention.
I would like to make two very quick comments before we introduce the next talk. One is speaking about the worker protected standard. The American Academy of Pediatrics and quite a few other organizations strongly argued for 18 as being the least low age that should be in the worker protection standard for application, because folks are still children, at least till they're 18, and subject to all of the susceptibilities of children. The other, not to contradict you, Dr. Calvert, but I actually interviewed the mother of this child that was born with no limbs and examined him. And in my extensive interview with her, she said not only did they not follow the reentry, but while she was working in the field, while pregnant, they were spraying 2 rows over, and they were extensively actually sprayed. It wasn't just reentry. They were being sprayed in the field regularly in Immokalee and in North Carolina by the same company. And when she and others complained of symptoms during this spraying, they were told to just go sit under a tree, drink some water, and when you feel better, come back and start working again. There was no notification of any medical facility or anything intended to improve the outcome after they had been sprayed and felt physically ill with symptoms that were quite typical of acute pesticide poisoning. So it went beyond ignoring reentry and notification. At any rate, I'm not contradicting you, I'm just saying what she told me. At any rate, our next speaker is Richard Callahan, PhD. His doctorate is in entomology from the University of Massachusetts at Amherst. He's done extensive work over the years in a variety of areas, but importantly for this talk, since 2009, he has been a collaborator with Alex Liu and Ken Warshaw concerning the subacute effects of neonics in honeybees. He has multiple peer-reviewed publications. He is a part of the New York Academy of Science, director of the White Oak Conservation Society, and is a director of the Worcester, I should know, I lived in Massachusetts for many years, Worcester County Beekeepers Association.
Okay. We're going to do a very quick review on what honeybees are, because I'm assuming there are people here that don't know much about honeybees. It's important to know that to understand what I'm going to be talking about, the honeybees are warm-blooded insects. You don't think of insects as being warm-blooded. They maintain their hives at temperatures between 85 and 92 degrees all year round. We live in New England. I've measured minus 20 Fahrenheit outside my beehives, and 10 inches away with a pine board in between them, it's 92 degrees. So they can put out a lot of heat. They store honey for the reason of not so you can put it in your tea. They do it so that they can have energy to keep warm. They are holometabolous insects, which means they have an egg, a larval, a pupil, and a adult cycle. You think of a butterfly, if you're familiar with caterpillars and a pupil stage and then the adult butterfly. Honeybees do the same. It's very useful and appropriate to think of a beehive, the whole hive, as a single organism. And the workers are really just parts of the body, and the queen is the kind of the stem cell of the hive. And so when you're thinking of dosing and long-term exposures, you really want to be thinking of that organism, not the individual, not an individual bee. Of course, the adult bee lives about 40 days in the summer, but they'll live up to about, I'm talking about workers now, the worker caste, they lived about 6-7 months in the wintertime. That's essential to get them through the winter. So what we've done in the past is we've over the period of about 4 years, the three of us have established between 20 to 18 hives a year. They weren't the same every year. 5 or 6 hives at 3 or 4 different sites. We used a replicated split block design in all our studies. I'll show you how that's set up in a minute. We fed them sugar syrups, not nectars, but syrups for about 27% water. Very close to honey, has about 16% water. And then we spiked these syrups with parts per billion levels of usually imidacloprid, and then fed it to them all summer. All right, fed these bees all summer long. Then we counted the brood bi-weekly. Every 2 weeks we go in and count the brood in every frame in every hive. And I'll actually show you how we do that. It's important to know that honeybees pupate for 2 weeks, so that by counting, and they're warm-blooded, so they're very consistent about the time they're in the pupal phase. So when we look at them every 2 weeks, we're actually counting the bees. This is an experimental site. That's Ken Watchell and the white hair there. We work the bees in the summer, in the spring especially. Summer we work them without veils, usually. We don't have Africanized bees there. You wouldn't do that here. It's important to kind of take a look. If you look right here, we're going to be taking, you see we're taking these boxes apart, and this is the bottom board that I'm going to show you in a minute on in another slide. So realize that the bottom board is when you take all the hive bodies off the hives. This is a healthy frame of bees. These are the cap brood here, and when we score these frames, there's 32 is a frame that would be totally covered with brood. Never happens. And this frame would be scored at like a 14. And these on the top here, these are bees eating and working on the crown of honey that's over the brood. What we found is, when we'd feed these bees all summer, we would get a slow decrease in the number of bees in the hive, which is normal. You could see no difference between the controls and the treated bees. And actually, the first year we did this, we got to the end of October, and I thought, well, we didn't see any effects at all. And we were about to just, we just by luck decided that we'd follow through with this and look at the bees all winter long. This just to let you know, this is simply the number of varroa mites in a hive at about August, and then after we treated them, showing that we had really reduced those populations. What we found was around December, we started to get some mortality. This is from the first year, but we've done this over and over again. We get about the same results every year. Around December, you start getting some mortality in your bees, and it's dose-related. And in the first year, out of 16 different hives, we killed 15 of them. We killed about 25% of the controls died during the winter, which in New England is about normal. But that really, that really wasn't the most important thing we found. This suddenly isn't working here. Here we go. Sorry. What we found was when we look at the bottom boards after we take the hive bodies off, this is a control hive, and this is the way a hive should look. What happens all winter long is bees die within the hive. They're slowly dying in the hive, and they're dropping to the bottom of the hive. And a few bees will leave on a warm day, but most of the hive, in the wintertime, bees die in the hive. This is Ken Watchell looking at this control hive and measuring out 3.5 liters of dead bees. However, and that is normal. When you look at our control hives, and I'm sorry, this is again the same frame, but showing you what a normal control frame would look like in the spring. This is what a control hive, a treated hive looks like. Notice the first year, there are just no bees in the hive. The hive is just empty. And that's strange. So we were wondering about what would be the mechanisms for this? Why and how could we measure what was really going on here? So we developed a little experiment. I had a theory that it might be something that was happening in the pupal phase, which is really an embryological phase, and thought it might be a malformation in the neural system, or it's also possible it was an effect directly on the normal adult bee. So we designed an experiment to test that. What we did, and you have to kind of think this through, we did this in a replicated fashion, but just think we had sets of hives, hive A and hive B. And hive A, we treated the bees with pesticide all summer as we had done on the other studies. And we got the same results as far as growth curves and all. Hive B, we didn't do it, we fed them just a syrup, as if they were control hives. And then at the end of the summer, After in October, when there was no more brood being made in the hive, and the queen had stopped laying eggs, no more brood, they're getting ready for the winter. We took all the bees from hive A, which in hive B, put them in, shook them out into a cage, weighed them, so we knew how many bees we had, and then we took the untreated bees and put them into the treated hive. We took the treated bees and put them into the untreated hive. So the untreated bees are now eating contaminated honey, and we fed them continually contaminated syrup the rest of the winter. So we now have bees that have never seen, naive to the pesticide all the way through the development and through pupation, and they're just being treated as adults. And we have some bees that were treated as larvae and a little bit as adults that are getting nothing all winter long. This shows a little bit about this. This is for the funnels we use to actually transfer the bees. These are the cages we put them into, and of course they were tired. And what we found was this. Here are the weights of the bees and the different treatments in the fall. These are controls. These bees are these bees were treated both as larvae and as adults. These bees were treated only as the larvae in early adult stage, and these bees were only treated as adults. They never saw pesticides until they were adult bees. These are the number of bees that were in the hives the next spring. We recovered about 47% of the bees from the control hives, and that's really an underestimation because when the bees die and get packed down on the bottom of that bottom board, they freeze and thaw and freeze, and they get packed down. They are not the same volume as bees. We don't correct for that. We got 47% recovery here. We got less than 5% in the adult bees. We got with bees that had almost 19,000 bees in the hive in October. We recovered 500 bees in the spring. All right, and that's pretty accurate because we can basically count the 500. Of the in the controls, you're getting several thousand back, but you're not getting anywhere near as much. So bees are just leaving. There's a behavioral dysfunction going on with honeybees that get low amounts of neonicotinoids. Now, other people in Europe have found similar results. There are other reports of behavioral problems, navigation problems, learning problems in bees that get sublethal amounts of neonics. So what we've done is we show that the neonics have a behavioral effect on bees, and our studies were cited by the Europeans when they banned neonics for a year in Europe. However, that's not the real significance, in my opinion, of the study, because, very frankly, neonics are a real problem for honeybees. There's no question about that. But they aren't probably the worst problem. Varroa is probably the worst problem. But what's really significant here is it's almost for sure that honeybees are not the only insects that are having behavioral dysfunctions associated with these pesticides at low levels. The neural system is extremely slow. It's so conserved that, as Dr. Guillette was saying earlier, my son did an experiment that was published in Nature in the 90s. He took Drosophila and showed how the axon in a Drosophila goes from, let's say, a place in your back and and down to your small toe, and as a embryo. It doesn't get there by accident. And he showed the pathway and the genes that control that in Drosophila, and then showed that his genes could rescue the Drosophila. They destroyed that gene in. So these things are incredibly conserved over millions of years in animals. So the idea, the likelihood that honeybees are the only bees that are going to be affected, have their behavior affected by neonics at this level is, in my opinion, close to zero. As you get away from bees, annelids, other arthropods, it's very likely they're being affected also. When you get further away phylogenetically from bees, well, then you get question. You have to do the experiments. But there's real reason to be very concerned about behavioral mechanisms being disturbed by neonicotinoid pesticides, and it's very important to understand that the mechanisms by which that works aren't known at all. We have no idea how those mechanisms work. There's tremendous inhibitions of behaviors in these animals, as well as stimulations, and how that stuff works, nobody really knows. Our work has been criticized. If you go on the web, we're castigated. We're the dumbest people you ever met. And our samples are too small, and that's probably true. We don't have any money. we fund it ourselves largely. But however, we've done this now for 3 or 4 years, so the numbers of hives are building. Our data is quantal, where an awful lot of our critics are publishing with very similar numbers of hives, but they have cascading sample sizes. For instance, if you look at parasites in bee intestines, you've got to subsample bees, do a dissection, subsample the parasites, and then do microscopic counts where you subsample the counts. And they're using the same numbers. We open this hive up, it's a dumb experiment. The bees are there or they're not. There's no estimations going on here. Second real criticism is that our doses are too high. Well, first of all, it's irrelevant. When you have a behavioral dysfunction and you don't understand what's making it work, what the dose is in some ways irrelevant, simply because it's significant. You need to understand what the mechanisms of these toxicities are, especially on materials that are being spread all over the world. Our critics have recently published their own study. Their low dose was 12.7 times higher than our low dose. Our higher dose. All right. It's just, you can't make some of this stuff up. It's amazing. Well, we've got 2 publications that are out. We've got another one we're making. This is how we funded it. And these are the 3 of us. I want to give my colleagues. This is Alex Liu, who's at the School of Public Health and at Harvard. This is Ken Watchell, who's probably, this thing's bouncing around, who's probably one of the better bee husbandry people in the country. He's a tremendous guy raising bees. And this was a piece of art made by this lady, Christine Zwart. It was on display in Boston last weekend. It is a faux. I'm sorry. It's kind of a faux frame of bee wax filled with dead bees, which we provided her with. Thank you very much.